I qualified as a nurse in September 2018 and went straight into practice nursing in Milton Keynes, and I've been there ever since and just developed my role from knowing practically nothing about practice nursing to now being heavily involved in the primary care network and the care programme. The care programme has built my confidence because it's the way it's structured and the support that they offer you makes you realise that all those wonderful ideas and enthusiasm that you have isn't squashed. And what they do is they give you techniques and ways to kind of express your fears and your passion and what you want to achieve, and say, yes, you can do that. Have you thought about this? And then by talking and engaging with other people that are in the same position, gives you that kind of boost to know that you are going in the right direction, and that what you're doing is benefiting your patients as well. And actually it gives you the sense of ownership of all these ideas that you have and improving outcomes for your patients and your colleagues as well. The weekly webinar sessions are fantastic. I find them really engaging. I like that we're all in one room as such. Everyone gets a chance to talk, and I particularly like the fact that you can go off into little breakout rooms and discuss things on a one-to-one as you would do if you were face-to-face. And when I first started, the first couple, I thought, I'm not sure how this is going to work because you don't get that face-to-face, that networking that you normally do. However, the way it's been run has been fantastic because although we've never met in person, having those small groups of networking, and they always mix us up so you're not working with the same people each week, and has enabled us to kind of get a bit excited about each other's ideas. It also gives us an opportunity to still discuss what we're doing and what we're thinking, and other people to say, actually, we've tried that, have you thought about this? So it's a really fantastic, and it's all about everything that we need to know. Even though we might not know we needed to know it at the time, everything has got a really good flow to how it's presented, and week on week it gives you ideas of, okay, so now we need to look at this step, and actually now we can plan this. So it flows really well, and it does help you along the over the weeks to build on your own project as well. I've been using the ShinyMind app most days. I find that if I've had a particularly stressful day, or I've been a bit let down by something, and actually being able to record those feelings and to then reflect on those really help. It's a really good way, especially if you don't have any colleagues in practice nursing. You can be quite isolated sometimes and not see another person all day. So actually it's a really good way to offload everything that goes around in your head, and to put it down on paper gives you a chance to let go of it, and then you can go home and not have to think about it or worry about it. As part of the care programme, I've developed a new project. I was asked to look at a weight loss programme. So I didn't really know where to start, so I decided that we'd start with the people that were involved, which were the patients. So asking them if they all wanted to lose weight, what was their struggles, what were their what was stopping them. We all know, and that was the main theme that came through was, I know I should eat less, I know I should exercise more, but I lack the motivation and I don't know what to do and I get bored. So using all of that, and also looking at as a community, so now as the PCN covers more than just my practice, I wanted to make sure that we use people within our local community as well. So I have amazing friends who do amazing things. So I have a friend who's a life coach, a fitness instructor, and a nutritionist, amazingly enough. So I use their services, and I asked them to come on board for free, and to help my patients. And it's worked amazingly well. So although I invited 24 patients to start with, only I think 8 turned up, which was fine. Each week we have a guest speaker. So they talk about fitness, and they then provided them with a little fitness regime if they wanted it. The life coach lady has been fantastic. So she works along all 12 weeks of the programme. And she does a bit of hypnotherapy with it as well, and looks at sort of your mindset. So we don't focus on diet, we focus on sleep patterns, making sure you drink plenty, taking those really small steps and basically breaking everything down rather than just going straight in for a strict diet and everything else. So we look at the whole person, quite a holistic approach. So the early outcomes that we're seeing at the moment were from the first cohort of patients. One patient lost 4 centimetres around their waist, which was really positive, and another patient lost 33 pounds in weight. So overall, what we also found using the Edinburgh Warwick questionnaire was that patients felt much better about themselves than they did at the beginning of the programme, and that was much more positive. So they were walking more, they were feeling better about themselves, so actually their well-being and their mental well-being had improved greatly, and they felt a lot more supported, and they made really good friendships and bonds with other patients, and they formed their own little walking group, so they were going out and doing more things together. And some of the patients that still come in say, you know, oh, I'm still keeping on top of that. So they've made those small changes and they've stuck with them almost 6 months down the line, which is fantastic. So as part of the care programme, I've also been working on another project which looked at COVID patients and those with mental health issues and had low contact with GP practice. And what we did is we had a small set of questions, which was, do you live alone? Are you under mental health services? Do you need any extra support? Is there anything that we can do to help you? And alongside that, we incorporated the social prescribing care plan, which was part of the NHS 5-year forward to every patient has a care plan. So I decided to use that as well. And what we found from that, the outcomes that we found were that I think it was 73% of our patients had unmet needs when we phoned them and required additional support. And that actually only 25% of those patients were under the mental health care team, and 42% felt that they weren't stable in their mood, and that was quite a high figure. So what we are looking at doing is making our own template to incorporate those few questions about their mental health and well-being, and also the care plan template, so that we can look at their social needs, not just their medical needs and their physical needs, but their emotional and social side of things. And then hopefully moving forward would be that we would then have a social prescriber within the PCN that could use this template to cover everything, and hopefully help patients signpost them to the right direction, whether it's to speak to the GP, whether it's social prescribing, extra support. I believe that the care programme is fantastic for general practice nurses. It's almost like it's been made for us. We see a lot of the patients on a one-to-one on a regular basis, and we become quite familiar with them and we understand their needs, and often patients will talk to practice nurses more than they'll speak to the GP, because they see us much better, much more often. And actually what this care programme enables practice nurses to do is we have these wonderful ideas and say, do you know what, if we could do this, it would make life so much better for our patients. And actually what the care programme has enabled us to do is say, great, where do you want to go with that? Here's the programme, we will help you get that idea off the road. And actually it's working fantastically. We're seeing better outcomes for our patients, we're engaging better with our patients, and actually what we're finding is that the GPs are listening to us more, and it's giving us a voice as nurses to say to the GPs, look, this is what the patients want, this is how we can improve your outcomes as well, and actually if we do this, we can have a much better service for our patients. So it's it's quite an amazing programme actually, and I'm really quite excited to be a part of it.